I have several issues with my eyes. I'd like to know what's the best approach to correct them all. I have very dark circles, bags on the side of my eyes, folds on top, and loose skin under my eyes. I want all the problems fixed, but I want a natural look. What's your expert opinion? I'm ready to do something about it. Thanks for your best advice based on the pictures provided.
Thank you for your question. So you've submitted a question with photos and you're asking about the best way to treat dark circles, eye bags, loose skin, and you are clearly, you wrote that you are ready to do something about it. Well, I think that you will certainly get some common agreement in terms of the procedures. But let's first begin with understanding what the problems are and then what the solutions are. So we'll start with the dark circles. Dark circles under the eyes is very commonly several factors. One is heredity. People who are genetically have dark skin under their eyes, usually it's more of a pigment issue. The other aspect of dark circles has to do with allergies and sinuses. Sometimes they refer to this as like allergic shiners or very dark, almost like a bruise look. Then other dark circles can be because the skin is so thin, you can actually see through the skin and see the actual blood supply and the muscles underneath. And all of them fall under the common term of dark circles. So that's one thing. The other thing is, what's the puffiness? The puffiness represents fat pockets. Now, under the lower eyelids, there are three distinctive fat pockets. And when they're all out as like a half moon or crescent moon kind of look, then usually all three fat pockets have pushed forward. They're the medial, central, and lateral fat pockets. Now, that's called lower eyelid fat prolapse. The other issues related to skin wrinkling or loose skin or excess skin. Well, that is a challenge because fine wrinkles of the lower eyelid skin is usually related to combination of age, loss of volume from collagen, as well as environmental effects. For example, someone who lives in a sunny climate, who has, even if they're not sun worshippers, they can get incidental sun exposure for many years. They'll have more photo-aged skin, which is more wrinkled, than someone who has not had that exposure. Then the aspect of the excess skin. Well, lower eyelids, it can be very tricky to diagnose excess skin. This is what gets a lot of plastic surgeons into trouble. They'll interpret lower eyelid skin as excessive when actually the skin is just enough, and if they take away just a little bit more than 1 or 2 millimeters of skin, the eyelid will get pulled down. So the strategy of your procedure is not only based on your photos, but really requires a physical exam. No one can actually tell you exactly what to do based on photos alone, but you can get some broad recommendations. So let's go down the list. For improving skin quality under the eyes to help dark circles related to thinness of the skin, as well as some of the crepey quality or the degeneration of the skin, I very frequently use something called platelet-rich plasma. Platelet-rich plasma is part of I think a new generation of medical treatment that has to do with regeneration. As we get older and as there's a lot of programming in terms of just like hair turns gray, skin gets thinner. Platelet-rich plasma seems to stimulate this kind of a collagen response, almost a healing response that improves the blood supply and the quality of the skin. I would also consider fractional CO2 laser to help with the texture. Now, this is very well established. It's based on a combination of chemical peel, the history of chemical peels, where taking off a top layer of skin results in a new layer of skin coming in that looks smoother. With thermal energy, you get a little bit of tightness. Again, there's an art to doing that and doing the best that's right for you. The lower eyelid fat prolapse, there's usually a combination of reducing the fat, whether it's through a transcutaneous or transconjunctival blepharoplasty. That means reducing the fat. For some patients, we want to do some repositioning, usually conservatively, and addressing what is prolapsed forward. That's the transconjunctival or transcutaneous blepharoplasty. And then as far as loose skin is concerned, if there is excess skin, typically we would consider something called a skin pinch blepharoplasty, where we take away just a thin strip of skin along the lower eyelid if a key part of the eyelid is well in good shape. And that part of the eyelid I'm talking about is called the lateral canthal tendon. That's the tendon that suspends the outer corner of the lower eyelid. So as you can imagine, there are many factors, and there are several different choices based on those factors on how to do the procedure that best serves you. So my recommendation is seek out a highly experienced cosmetic surgeon who knows the eye area really well and has the experience that will give you the confidence that the doctor knows what to do, and also get a sense of the style. There is a lot of different styles to doing cosmetic surgery, and once you get a sense of resonating with the cosmetic surgeon you choose, I think you'll be in good shape to pursue the improvement of your appearance. So I know that was a lot of information. I hope that was helpful, and thank you for your question.